Hey, this is Matt again at Competitive Edge Physical Therapy. Today we're talking about our third and final video on how to prevent Tommy John surgery. So in the last couple of videos we talked about what causes the Tommy John surgery, how that injury normally happens, and some of the risk factors as well as the mechanics of pitching that can lead up to that. So today we're going to talk about the exercises that we could do, put a little program together of 5 exercises to help prevent the injury, because we know that through pitching it puts a lot of valgus stress on the medial collateral ligament, and we know that that ligament can't handle all the forces that go through in pitching. So a lot of those forces have to be adapted by the strength of the tissues around the elbow. So let's go through a couple exercises that we can do. The first one is called wrist roll-up, and in this exercise you're really working all the wrist flexors that cross the elbow joint and help support that there. So all you need is a dowel, some string, and a weight, usually about anywhere from 5 to 10 pounds. Arms are going to be straight out in front of you, knees slightly bent, make sure you're not arching, and you're just going to, nice and slowly, flex the wrist on each side, pulling up until that comes all the way up, and then you're going to slowly go back down. Again, you can do that. You want to do a lot of weight, you want to be sore the next day, right in the wrist flexors, making sure you're doing it with enough weight, with enough intensity, and enough duration that you're really going to stress those muscles, because pitching is a high intensity sport. So around 3 sets of 15, start there and work your way up. Another exercise we could do is wrist pronation supination. So you're going to grab a weight, anything with a longer lever arm is going to help create more of a torque, so even a hammer will work. And you're just going to rest the forearm on something stable here. Keep in good posture. Start with wrist facing up and just very slowly turn the forearm until the hand is down, and then back to the starting position. Again, doing with enough weight and enough reps to really try to replicate the forces that are going to be happening during a game while pitching. The trick here is to go as slow as possible, as most people will tend to just speed through it. Third exercise we'll talk about is for the biceps. So doing biceps curls is another muscle that'll help stabilize that elbow during pitching. It is absolutely okay to do bicep curls like you normally would, shoulders back, elbow at your side. But another way to think about it is do it a little more functional for pitchers, actually in the pitching motion. So with their leading leg in front, elbow at 90-90, and really keeping the shoulder back and down, not letting it move too much. You could do the bicep curl out to the side and in right here. And that's really what the bicep's doing during the throwing motion, is trying to keep the arm in this position 90-90 and not get too far out, which is one of the risk factors for pitching that we saw. So again, with enough weight and enough intensity to really get fatigued and feel the soreness the next day. Fourth exercise we could do, you'll see pitchers doing this all the time, working rotator cuff muscles with external and internal rotation on the band. Again, you want to make this as functional as possible, not down here at the side, but up in the pitching motion. So 90-90 degrees, pinch the shoulder blades back and down. You want to keep this as stable as possible and not let this move. So you don't want to see it dip down, but truly just spinning on an axis right here. Again, with enough strength, enough intensity to create some soreness in that rotator cuff. If you need more resistance, step back. Start out with 3 sets of 15 and work your way up from there. And the last exercise we'll talk about, fifth one, is doing what we call prone W's to Y. So you're going to be on the ground for this one. Grab anything you can, a Bosu ball, a Swiss ball, anything that's just going to help you get you off the ground a little bit. And what you want to focus on is same thing, pinching. This is a shoulder blade exercise, really working on the lower traps for that stability at the shoulder blade while pitching. You're going to go from a W position up to a Y position while laying on your stomach here. So again, making sure you're not arching from the back too much, feet on something stable. Start in this W position, pull the shoulder blades back and down, keep the chin tucked, and raise it up into that Y position, making sure that the shoulders stay down, not shrugged up towards the ears. Again, nice and slow. Start with 3 sets of 15. You You can make that harder by adding some weights into the hand or increasing the reps. So that's a little program we're going to have for you today. Try that out, and that will help really strengthen all the muscles around, preventing that valgus force going through the elbow. Again, feel free to contact our clinic if you have any questions. Thanks for watching.